have asthma, you know how hard it can be to live with this condition. Everyday activities are difficult when breathing is an effort. An asthma flare-up can catch you off guard, wake you from sleep, begin during exercise, or make cold weather unbearable. Sometimes breathing might even seem impossible, and you need to rush to a hospital for emergency care. Asthma affects more than 13 million Americans. Recently, the Centers for Disease Control and Prevention reported a 42% increase in asthma cases, particularly among children, and a 40% increase in asthma deaths since 1982. All across the country, hospitals are treating more asthma patients than ever before, especially when those patients are having sudden flare-ups. The National Institutes of Health's National Asthma Education and Prevention Program has developed treatment guidelines that encourage patients to become more involved in their asthma care. Clinics, hospitals, and doctors' offices are showing patients what they can do to make living with asthma easier.
Your doctor has prescribed an asthma medication that is delivered directly to your lungs by way of a metered dose inhaler, often called an MDI or puffer. It works like this. An MDI is one of the most convenient and effective ways to get medication directly to your lungs. Some patients find it difficult to use an MDI. To make it easier, your healthcare provider has prescribed a valved holding chamber called an optichamber to be used with your MDI to get the most medication possible to your lungs and not on your lips, face, or at the back of your throat. Taking your medication with optichamber is easier than using an MDI alone. Optichamber can help improve delivery of medicine to your lungs and in turn helps prevent the unwanted side effects that sometimes occur in the mouth and throat with the use of certain aerosol medications. It may also help reduce the bad taste of some drugs. Here's how to use your optichamber with an MDI canister. Remove the mouthpiece caps from both the MDI actuator and the mouthpiece of the optichamber. Look inside both ends of optichamber for any objects that don't belong there and check your unit for damage. Insert the MDI mouthpiece firmly into the oval opening at the end of the optichamber. Hold your optichamber and MDI together and shake well, at least 4 or 5 times. Place optichamber in your mouth and close your lips firmly around the mouthpiece. Stand or sit with your head straight up. Exhale. Spray 1 puff of medicine into optichamber and immediately begin to inhale slowly for 3 to 5 seconds, taking a full deep breath. Optichamber's high flow warning signal will alert you if you're breathing in too fast. If you hear that signal, breathe more slowly and continue to inhale with a full deep breath to allow the medicine particles to get deep into the lungs. Remove optichamber from your mouth. Hold your breath for as long as you can for up to 10 seconds, and then breathe out slowly. If your doctor has instructed you to take more than 1 puff of medication, repeat this procedure. Be sure to wait at least 1 minute between each puff or follow your doctor's prescription. If you take several MDI medications, you can use your optichamber with all of them. Your healthcare professional will tell you which medication to take first. Remove the MDI from optichamber and replace the protective caps on both the MDI and optichamber before you put them away. Remember that after taking certain medicines, you need to rinse out your mouth thoroughly with water without swallowing the water. If you have any questions, be sure to ask your healthcare professional. To make your optichamber last longer, it has been designed to be taken apart for thorough cleaning and, when necessary, to replace the valve. With routine cleaning, your optichamber will work well for a long time. Your optichamber should be cleaned several times each week. Clean all the parts with warm water and a mild dishwashing liquid and let them air dry. The more medications you take with your optichamber, the more often you should clean it. When the parts are dry, reassemble optichamber by holding the chamber upright and placing the holes of the round gray valve over the clear posts of the chamber. Screw the mouthpiece on securely, making sure the valve is flat and in place. When replacing the end cap, align the edges of the warning signal with the raised lines on the side of the end cap so the warning signal will fit into its proper space. OptiChamber face masks are available in 3 sizes: small, medium, and large, and easily attached to the mouthpiece of the OptiChamber. Face masks can be used if a patient is too young or does not have the coordination to breathe in using the mouthpiece. Because masks attach to OptiChamber's mouthpiece, a single unit can adapt to a growing patient as the patient's needs change, allowing young patients in particular to learn to use a holding chamber without a mask at the youngest possible age. Here's how to use the OptiChamber with a face mask. Remove the mouthpiece caps from the OptiChamber and the MDI. Look inside the OptiChamber and remove any objects that don't belong there and check your unit for damage. Place the mask over the OptiChamber's mouthpiece until it fits securely. Insert the MDI into the oval opening at the end of the OptiChamber. Hold OptiChamber with mask and MDI together and shake well at least 4 or 5 times. Place the mask over the patient's nose and mouth so no air or medication can escape. As the patient exhales, spray 1 puff of medication into OptiChamber. The valve system prevents the aerosol from escaping. When the patient inhales through his mouth, the medication will be inhaled as well. Continue to hold the mask in place for at least 6 breaths after spraying the medication. Let's review the steps for using OptiChamber with an MDI. Remove the mouthpiece caps from both the MDI actuator and the mouthpiece of OptiChamber. Look inside both ends of OptiChamber for any objects that don't belong there, and check your unit for damage. Insert the MDI mouthpiece firmly into the oval opening at the end of the OptiChamber. Hold your OptiChamber and MDI together and shake well, at least 4 or 5 times. Place OptiChamber in your mouth and close your lips firmly around the mouthpiece. Stand or sit with your head straight up. Exhale. Spray 1 puff of medicine into OptiChamber and immediately begin to inhale slowly for 3 to 5 seconds, taking a full, deep breath. Remove OptiChamber from your mouth. Hold your breath for as long as you can for up to 10 seconds, and then breathe out slowly. Taking your medication regularly and correctly with OptiChamber will make living with your asthma easier and will allow you to do more of the things you enjoy.